Good evening, everyone, and welcome to WMBC News Tonight. I'm Nicole Israel. Thanks for joining us. Now, of those stories and much more news tonight. But first, it's a small-known problem that every parent needs to know about. Brain injuries are one of the leading causes of death in children and young adults in the U.S. They can happen in the most unsuspecting of circumstances. And tonight, Lisa Wojcicki reports on new legislation that could help save lives.
Happy birthday, dear Sarah Jane. Happy birthday to you.
Sarah Jane Donahue just turned 6, and today she is celebrating a special birthday gift. Not just cake, but the announcement of the National Pediatric Acquired Brain Injury Plan. It would develop a national model of care for families struggling with brain injuries. When Sarah was just 5 days old, she was shaken violently.
When you have a child with a brain injury, they're all outliers. Every single child with a brain injury, because you're dealing with a developing brain, they're all over the map.
One day, the kid's at school, and they come back, and now they have a brain injury. Your life has just changed for the rest of your life and your child's life.
What I have learned in discussing this issue with families and experts here in New Jersey and across the country is that systems of care vary from state to state, from school district to school district, and from medical facility to medical facility.
New Jersey Congressman Leonard Lance will formally introduce the bill on the House floor next week and has bipartisan support. Donahue and brain injury survivor Craig Sears have rallied for such legislation for years. After a motorcycle incident about 20 years ago, Sears was in a coma, experienced memory loss, and was put in a mental institution and socially shunned.
For myself, I wish on that July afternoon, 20+ years ago, that there was a national PABI plan in place for me. I wish the states, the doctors, the nurses, the cops, the judges, the people, whoever had the power over me, had a clue about traumatic brain injury. I wish that when I needed it, there were people to turn to, answers to the questions I didn't even know I had, and the resources in place for me. I can't help but wonder how different my life would be today.
According to the Center for Disease Control, about 80,000 youth under the age of 25 are hospitalized every year for a brain-related injury. 11,000 will die, and Sears was almost a part of that statistic. He says this bill will help prevent other deaths as well.
I know what it means. Like the song goes, I know what it means to walk down a lonely street of dreams. Okay? And today is just our Independence Day.
More than 765,000 American youth enter the ER every year with a new brain injury. 80% of them are considered mild. In just 5 years of being open, Overlook Medical Center's Neuroscience Institute has seen more than 3,000 patients.
Why is this bill so important? Integration, services. Hopefully this will allow all these services to be put into a package where people will know where to go.
Our son Cole has an incurable brain condition called hydrocephalus. This bill can be considered a hydrocephalus prevention bill because many brain injuries lead to that person developing hydrocephalus, including Congresswoman Giffords, who was tragically shot in January.
Brain injury effects range from seizures and paralysis to cognitive and emotional consequences. Advocates call the current lack of structure to treat them a public health crisis and hope this legislation will change that. Reporting at Overlook Medical Center in Summit, I'm Lisa Wojcicki for WMBC News.